Chronic lymphocytic leukemia. CCL is a type of cancer of the blood and bone marrow, the spongy tissue inside bones where blood cells are made.
What happens to the cells? The leukemia cells grow out of control and crowd out normal blood cells. These cells often build up slow over time. As the cells build up in the bone marrow, they cause reduced levels of white blood cells, which normally defend the body from infections, leading to a higher chance of catching secondary diseases.
What parts of the body does it affect? It affects the lymph nodes, liver, spleen, and spreads to major organ tissues.
Symptoms. The leukemia is usually found when doctors order blood work or when you have a normal checkup. But some signs of CCL include feeling weak, feeling tired, weight loss, having a fever, sweating at night, frequent infections, enlarged but painless lymph nodes, pain in the upper left portion of the abdomen, which may be caused by enlarged spleen.
Causes of CCL. Some causes are exposure to certain chemicals, family history, gender, race, and ethnicity. Some studies have linked CCL to be caused by Agent Orange, an herbicide used during the Vietnam War. It also can be caused by exposure to farming pesticides. With family history of CCL, you are twice as more likely to get CCL.
Prevention. Many types of cancer can be prevented by lifestyle changes to avoid certain risk factors. But there are very few known risk factors for CCL, and most of these cannot be avoided. Most CCL patients have no known risk factors, so there is no way to prevent these cancers.
Treatment. CCL grows very slowly, so you might not need treatment immediately. Instead, doctors might watch you very closely. But when the time comes, doctors will use these 3 treatments: chemotherapy, targeted therapy, and monoclonal antibodies.
What are these treatments? Chemotherapy is the most common treatment for CCL. Chemo kills cancer cells. Chemo is usually given through a vein, through the spine, or as a pill. Once chemo is given, it goes through the whole body. Doctors give chemo in cycles which last 3 to 4 weeks. Monoclonal antibodies are man-made antibodies that attach to a certain place on a leukemia cell. They kill the cancer cells or tell them to die. This drug is given in the vein and is usually used alongside chemo or with it. Targeted therapy. Targeted drugs are a newer way of treating CCL. The pill/injection affects leukemia cells and not the normal cells in the body, and kill them off. The treatment has different side effects, usually not as bad as chemo.
How is CCL diagnosed? Blood cell counts. This is often the first step done to see if you have CCL. Most people with CCL have too many lymphocytes in their blood and not enough of other type of blood cells. Bone marrow aspiration and biopsy. This test is done to see how bad the CCL is. Most of the time, a doctor uses thin, hollow needles to remove small amounts of bone marrow, usually from the hip bone. These samples are sent to a lab to see if there are leukemia cells in the bone marrow. Spinal tap. This test is usually not needed for people with CCL, but can be used. A doctor uses a small needle and places it between the bone of the spine to draw out some of the liquid, which is checked for leukemia cells. Lab tests for leukemia. Samples from blood, bone marrow, spinal fluid, or lymph nodes are looked under a microscope to help the doctor find out what kind of leukemia you have. Other blood tests. If you have leukemia, blood work done to see how well your major organs are working. A CT scan. This test uses an x-ray to look deeper inside your body. This is useful to see where the leukemia has spread, such as lymph nodes in the chest or to organs like the spleen or liver.
Who is most likely to have CCL? CCL is slightly more common in males than it is in females. CCL is also more common in North America and Europe. Doctors have found that the race/ethnicity you are doesn't matter when you're having CCL. They're just more common in certain people. Doctors think CCL has more to do with genetics instead of environmental factors.
How many people is affected by CCL? About 20,940 people are affected.